support is coming for the aviation industry, expresses satisfaction with compliance to COVID-19 protocols at the airports. And more top officials in the Trump administration test positive to COVID-19. The Lagos State government is setting up a new facility where suspected COVID-19 patients are to be held. The facility, holding area with a 20-bed capacity within the premises of the Lagos State University Teaching Hospital, LASUTH, would soon be in use. According to the Chief Medical Director, Professor Adetokunbo Fabamu, the facility will help ensure that patients infected with the virus are separated from others. Our correspondent, Titilayo Aberewo, tells us more.
Normal activities are gradually returning to Lagos State, but with conscious effort at staying within the COVID-19 safety protocols. Even though Lagos is already experiencing what the incident commanders call a decline in COVID-19 numbers, the government is still setting up facilities. The latest being this holding bay and eye care unit at the Lagos State University Teaching Hospital. This is one of the 20 rooms where suspected patients of COVID-19 will be isolated for a while until their health status is determined by the doctors and eventually transferred to their appropriate quarters. One of the doctors explained the need for the facility.
We run 24 hours shift here. So we have 2 doctors per shift. We have 4 nurses per shift. We have 4 other health workers, supportive health workers. Patients will come in through the emergencies. If we have suspicious cases, they inform us. We go to review with them. So we admit in the long run, and then we start our process.
The pandemic is clearly an eye-opener to the importance of being ready for emergencies. Senior officials here insist the deadly virus is still with us.
During the peak of the pandemic, because we are still in the pandemic, during the peak, a lot of patients who were COVID suspects had nowhere to be accommodated. So we thought of this concept of a holding bay where you can keep COVID suspects pending the outcome of their results. And so that's what we have here.
COVID can be divided into 2 types, the bread and butter COVID and the complicated COVID. And right earlier on, we had a number of conversations between myself and the CMD and the board to say what should be the role of a tertiary academic institution in the combat or the battle against COVID. And my advice was that LASUTH shouldn't get involved in day-to-day ordinary COVID management, but that LASUTH, as its status reflects, should be dealing with complicated cases that we cannot manage in any of the standard isolation centers.
The wife of the state governor, who is also a medical doctor, says this is the time to do more for the health sector.
It is important to emphasize that now is not the time for us to rest on our oars. Rather, it is a time to remain conscious of the pandemic and to continue to intensify efforts of flattening the curve.
The holding bay is a purpose-built self-contained 20-bed facility with a provision for 4 intensive care units with high-tech medical equipment and personnel that will provide specialized eye care services. Titilayo Aberewo, Channels Television News.
The incident manager of the COVID-19 response in Edo State, Dr. Andrew Obi, says continuous testing for cases across the state are possible reasons for reduced caseload. Dr. Obi explained that plans are underway to further increase the capacity, even though patients are few in the isolation centers. He spoke in an exclusive interview with Channels Television in Benin.
The only thing that has happened in the past few weeks is that testing has been on the low side. And the reason is simple. Testing, I said we have tested over 18,000, carried out 18,000 tests. Each test on the average has cost the government, on the average, 40,000 naira per test. And there's huge financial implication in our ability to carry out this response. Well, the good thing is that the challenges had come, we have been able to flag it up, and some support has come. And so in the next couple of days to weeks, we are going to ramp up testing. So when you see our figures in the state, for instance, Edo State yesterday, 3 cases, the other day, 3 cases, some days, no case. It's not that COVID is gone, it's that our testing actually reduced over time. But we have looked at it, identified the challenges, and we are working around it to make sure that we increase testing again. And I'm very sure by the time we increase testing across the 18 LGAs, our numbers may increase. So COVID is not over. It's going to be with us for a long time. COVID has actually redefined the way we live, what we are going to do. Now, if you have a need to carry out a test, you can come to the EOC. This is a sample collection and a collation point. You can reach out to the ministry, Edo Specialist Hospital, Stella Obasanjo, UBTH, IROA. But apart from that, Edo State, we have 18 LGAs. Each LGA will have a rapid response team in each LGA. And so what we have actually done moving forward is that the rapid response team details for each local government are distributed to schools and churches. So if, for instance, there's a need for sample collection in school XYZ in Oredo, the first person that school's proprietor or the head teacher needs to reach out to is this local government DSNO for Oredo. So that we have circulated around. And what they just need to do is just to give a call, and the team will come to that location and collect the sample. For any other person that wishes to carry out a test, he can locate any of the centers that I've talked about. Another important thing that we need to note here is that there are some persons who don't meet case definition for testing, and those persons may need to pay a fee. Those persons include people who want to get tested because they want to travel out. And so the NCDC has recognized Lilly Hospital, which is a fully private-owned laboratory. So if you need to travel out of the country or travel out of the state, you're not sick, you're not having cough or catarrh fever, difficulty in breathing, and you need a COVID test, then you can go to Lilly Hospitals and they will take a test from you at a fee, and the result will come out almost immediately.
From Edo to Jigawa State, where the government says it has concluded plans to escalate surveillance as schools are set to reopen on the 25th of October. The Executive Secretary of the Jigawa State Primary Healthcare Development Agency, Dr. Kabir Ibrahim, who spoke to newsmen in Kiawa, says all schools are expected to be fumigated. According to him, schools will be under an escalated surveillance with sample collection centers in all the local government areas.
Jigawa State, in Nigeria's northwest region, is one of the 15 states that met the criteria for GPE funding and will benefit from financial incentives put in place to assist the states in implementing the education COVID-19 plan. For over a month now, the few patients at the State Isolation Center have been discharged and the facility shut down owing to no caseload and normal business activities, which has since resumed. The state government says all plans have now been concluded to reopen schools in Jigawa State. But this, they say, can only happen under strict adherence to safety protocols.
We have already engaged different stakeholders to make sure that we have a safe take-off for children that are resuming. We have already pre-positioned contamination materials where they are going to decontaminate schools and where children are going to play around. And there are already protocols to make sure that people use their mask, especially children and their teachers. We're also making sure that schools have provided places where they can provide hand washing facilities. And we have put very strong surveillance mechanism in place to make sure that if there are issues, we'll pick them in good time and address them in good time.
This safety compliance idea is also welcomed by parents as they ask for government to make do with their pledge to protect their wards.
The opening of schools by the federal government is a welcome development, provided both states and federal government will try to ensure that all the much needed medical facilities in form of preventive measures to this COVID-19 pandemic is put in place across all the schools in the country for the safety and protection of lives of our children.
As schools prepare to reopen across the state, the state government should endeavour to clear and disinfect all schools which have been left with no activities since the month of March.
On to Cross River, where the government has organized a two-day training for teachers, head teachers, and principals of all public schools on the COVID-19 prevention protocols ahead of school's resumption. While addressing the stakeholders in Calabar, the Commissioner for Health, who is also the COVID-19 Task Force Chairman, says the training is necessary and aims to create a link between the task force team and the public schools, both at the state and local government levels, for quick responses in case of suspected cases.
What we are doing is to hold training for our teachers, head teachers and principals of all public schools in Cross River State. We've done an engagement for the private schools, and presently we are engaging to train those who are in the public schools in Cross River State. We're teaching them the infection prevention and control protocol. We're teaching them what the expectations will be as they go back into the schools to teach our children. We want to be sure that we link the team in the school with the rapid response team at the state level and at the local government level. So if they have suspected cases of COVID-19, they know who to immediately call for help. We're also teaching them the protocol which they must observe every single day and what they're expected to do as our kids go back to school. It's important that they continue to ensure that all the basic safety measures are put in place, including running water for our children to wash their hands as often as possible, including face masks for every child that's going back to school, hand sanitizers, disinfectant machines, disinfecting toenails, as well as other temperature check machines, digital machines that can help them continue to keep track of every child that's within their premises.
Yobe State says since the outbreak of COVID-19 in February 2020, the state has recorded only 76 confirmed cases of the disease across its 17 local government areas. Its Commissioner for Health, who also is the Vice Chairman of the COVID-19 Committee on Prevention, told Channels Television that 8 persons have died. So far, 65 have been discharged, while 3 are still on admission. He also says the molecular laboratory located in the state capital had earlier been reactivated and commenced testing of all COVID-19 samples 2 months ago.
The total number of confirmed cases in Yobe State stand at 76 cases. Out of them, 65 were discharged and 8 died. And the current number of active cases is 3. The molecular testing lab has, we have already activated the lab. The lab has been testing samples since August this year. As it is, all our tests are actually done here in Damaturu, Yobe State. We have received support from the NCDC and the U.S. Center for Disease Control.
Let's talk now to consultant public health physician, Dr. Tosin Onosoya. Dr. Onosoya joins us via Skype, I believe it is, from Antony Village in Lagos. Good evening, Dr. Onosoya. Thank you for your time.
Good evening. I'm happy to be here. Thank you.
It does seem as if we're settling into some kind of normal now. The schools are reopening. Things seem to be progressing sort of at a stately pace. Are we becoming complacent, do you think?
I think so. I think we are. You hardly see people wearing masks these days. People wear it to decorate their neck, decorate their head. So I think they are trivializing the threat of COVID. And the COVID is still very real. We still have COVID. We can see what is happening in other countries. We still have the threat in our midst, and people need to take it serious. Now we have testing sites. Sorry?
Please go on. Please go on.
Yeah. We have testing sites in 20 local governments. They have decentralized the testing. So we have 20 sites that people can go testing. And this is to make sure that it's accessible to people, that people can, at every local government, go and have, test for COVID. whether they are symptomatic or they are contacts of a known COVID case. So they need to go and test. But people are not coming out for testing. People that have symptoms, they just treat themselves at home, go to chemists and just pick a cocktail of drugs and take without testing. So, but they need to test and really know that it's COVID, and they need to let us know the contacts of, people that they've contacted within maybe the last a week, having symptoms, so that those who can come for testing, and then if they need to be treated at the isolating ward, they will be treated there. If they need to be treated at home, depending on how their symptoms are, if they are symptomatic or they are not symptomatic. So people need to come out and come for testing. So we still need to take the threat of COVID seriously.
Talking about taking the threat of COVID seriously, there is the ever-present one that comes with reopening of institutions, schools, mosques, airports, and things like that, churches and all of that. But I want to zero in on the one of schools, because schools are now in the month of October reopening. Various schools across various states are reopening. Do you think what has been put in place is adequate to ensure that reopening doesn't lead to a possible spike in the caseload?
Well, a lot has been done by school administrators. For example, the school of my children, I've gone there, I've seen what they've done. They've made hand washing, available. Even children getting to school, they wash hands before they mix, they wear their mask and all that. So that is good, but they still need to keep it up. Maybe it's not all the schools that are doing that. So the government needs to go out to supervise what the schools are doing. Even the schools need to take it serious. Even if the children are not symptomatic, they still need to take it serious, because at any time you can have asymptomatic cases. That is people that are having COVID and they are not showing symptoms. And we have that, so common in children. They may have the COVID and they are not showing symptoms, and they get to mix with other students. So they need to take it serious. The arrangement in class, they should sit apart, If possible, they don't need to go for assembly. All those groupings, gatherings may be avoided. And then you have less children in classes. In fact, some schools are even still doing virtual teaching, so they need to take it serious. And then I think government is doing so much, and government can still do much more. Even the school administrators who can still do much more. They need to train their teachers too. Even the teachers too need to, observe IPC, that's infection prevention control practices, even in school. When the children come to school, at any time they have break, they need to wash their hands. So a lot has been done already, but they need to keep it up, because, the threat is still out there. And until it's out of all the other countries, we are still, we can have the spike at any time. So we need to be ready and, do the right thing.
Dr. Onosanya, please stay with us. We're going to take a break at this point in time. When we come back, we're going to talk a bit more about the issue of schools reopening, as well as the other developments in our battle against COVID-19. Please stay on with us. Thanks for staying tuned. Welcome back to our COVID-19 update. Before the break, we were talking to Dr. Tosi Onosanya, who is a consultant public health physician. Dr. Onosanya, thank you for staying with us. Before the break, you were talking about the fact that in the schools that you've seen, a lot has been done, but a lot more could still be done. There's another side to this, and that is the side of the students themselves not being particularly susceptible to complying with protocols. And being, a bit more rowdy, shall we say, than the adults who are there. But with everybody not complying, or with nearly everybody not complying with COVID-19 protocols, where are the examples from them to learn from?
Well, the parents, I think this is where we come in as parents. We need to let our children know what COVID is about. We need to let them know how to catch COVID, how you can be at risk of having COVID. So the parents need to do more. Even at the school, the teachers need to let the children know why they need to be protected, why they need to wear their mask, why they need to wash their hands, why they need to stay 6 meters apart from other colleagues. So once, they teach them, I believe children, they obey, they obey elders, and once they hear from home, they hear from school. They are going to conform, because we have no choice. We need to just do the right thing. So And then I feel the school administrators, they need to disinfect the school. They need to disinfect, make sure that the environment is clean, make sure that their toilet is clean, the classroom is clean, and then even train their teachers. They need to even train these teachers. So they need to go a step further to organize training on infection prevention practices for even the teachers, so that the teachers will even know what to impact the students. So it's not just for them what they read in papers alone. They need to be trained in what to do. So there's a lot that needs to be done. We need to put in more effort in this. And apart from us, apart from us trying to reduce the risk of COVID, there are lots of other diseases that we can reduce the risk by following all these infection prevention practices. There are other related diseases that have, the way they transmit is similar to COVID. So it's not only, protecting against COVID, we are protecting against several other diseases. So these are things that should come, that we have to move in, apart from, post-COVID, apart from what we are experiencing now. These are things we need to take away. Having a clean environment, washing of hands before you eat, after you eat, washing your hands after a long time, wearing mask. So these are the things that take home from, COVID era. So that's my feel.
All right, then. Thank you so very much, Dr. Tosin Onosoya,
Thank you.
consultant public health physician, for your perspectives on the program this evening. It's cheering news that the Nigeria Center for Disease Control, the NCDC, has not reported any death in 3 straight days. It, however, reports 180 new cases from 14 states. Lagos has 41 of those cases, Rivers 19, Osun 17, Nasarawa 13, Kaduna and Anambra recorded 5 cases each. Edo, Ogun, Kwara, and Ondo each have 3 cases, while Katsina and Niger have 2, and Plateau, as well as Akwa Ibom, have reported 1 case each. This has put Nigeria's numbers inching close to 60,000 confirmed cases. 51,308 of those have been discharged. The Joint Public Service Negotiating Council of the NLC and TUC have suspended the indefinite strike action they embarked upon a few hours after it started, and that's in Taraba State. The leadership of the unions had called for the strike to table their demands soon after the state government asked all workers to resume after a long stay away from work owing to the COVID-19 pandemic. The latest development follows the approval by Governor Darius Ishaku for the implementation of the national minimum wage and the signing of a memorandum of understanding for the suspension of the strike action. The head of service says civil servants need not be anxious for any agitations, but resume work.
The head of service.
I want to say that we should always place our trust in God, because God does everything beautiful in His own time. I know when I was saying that we should be patient, some people they didn't take it lightly. Then look at us today, it's a testimony. I want to say that since this agreement is going to be signed, let every civil servant in Taraba State not be anxious for anything, but come back to work. As they come back to work, they should try as much as possible to put in their best to show that, yes, this 30,000 minimum wage that will be given to us will be paid to us. At least it will be accounted for. So thank you very much, and I wish us the best in Taraba State.
As secondary schools resume in Kwara State, the governor, Abdurrahman Abdurazak, has called on schools management authorities to ensure cleanliness of their surroundings and comply with all COVID-19 measures. A visit to schools in the state capital, Ilorin, shows the teachers and students are showing signs of readiness to comply with the directives.
Schools across Nigeria are beginning to open up in phases after the compulsory closure owing to the COVID-19 pandemic. In Kwara State, however, This moment is one of the high points of preparation for school resumption, as the governor clears overgrown grasses in one of the secondary schools in the state.
Contribute to your community, get out there and do something. If you help repair a class, if you help cut the grass, there are things you can do to contribute to your community. After all, if your children are not in the school, you have neighbors, relatives who have children in the school, so we should take ownership of the schools in our community.
At the resumption, Channels Television visited some schools in the state capital. Here, COVID-19 measures are enforced at all levels. Teachers ensure the use of face masks, washing of hands before entering the schools, and the use of hand sanitizers. Some of the students shared their experience while at home.
At first, we find it very uncomfortable, but as time goes on, we find that we have to do it. It's for our own good, actually, so we soon get used to it.
As the students settle down for academic activities, tutors and school owners call for more assistance from government at all levels to stay safe while in school.
It's now been a month since the international aviation sector was reopened following a prolonged shutdown in the wake of the COVID-19 pandemic. Strict compliance protocols were put in place for both domestic flights and international flights, which had been restarted earlier. Now, how far has the industry recovered from the COVID-19 virus? We spoke to the Minister of Aviation, Hadi Sirika.
Am I happy so far? Yes, I am. I'm glad that we opened. I'm glad that we have set up certain protocols as to what would happen in our airports once they are opened. And they are being respected. Of course, it's not hitch-free, no. It's not hitch-free, but substantially, the airlines, the passengers, the workers, and everybody is substantially complying with our protocols. And we're seeing the numbers in Nigeria for being what they are. So we have done a lot in our airports to ensure that everybody is safe. We also have put out enough information out there for our passengers and travelers for what they need to do to ensure that it's safe. So yes, to your answer, I am satisfied. Of course, also, I wouldn't say 100% for the international, and so also for the local. The local flights, because now we fly into every single airport in Nigeria, and we have just recently opened all of the airports in Nigeria, including those that are not owned by government. I would say that the activity around those airports is not as smooth as it ought to be, but substantially also is good enough to go.
What is the true position with the issue of help from government to the aviation sector?
So government developed an economic sustainability plan for the entire economy of Nigeria, of which aviation is subset. And in the thinking of government, that the government should offer some help for all businesses, inclusive of aviation, to survive. And in that plan, well thought out plan for that matter, aviation has also been factored in. And it would be, at the time, it was two kinds of help that will come from government. One of which was through the central bank. They will be giving out loan about 5% to the airlines to be able to retool, to pay salaries, to do X, Y, Z. I personally, as a person, have a bit of concern. When you ask me as an entrepreneur, I take a loan from you and pay my salary. The meaning of that is that I'm paying salary plus 5%. So the wages have increased by 5%, if you like. But because we're in a very unusual circumstance and unusual times, and whatever help can come, that will come, we should accept, so to speak. But as to regards retooling and, generally, including buying planes, buying engines, and going for maintenance and services, I think it's a very good one from government, because 5%, and perhaps you have a moratorium period of 2 years or 3 years, and then you pay over a period of 7 years or so, or up to 10 years. I think this is something noble, and this is something that will help the industry to come back. So this is one part. The other part is that government intended to give some palliatives, some grants, some donations. It's not going to be as robust as that one that is coming from Central Bank, and that should go to the airlines and all other aviation businesses, including our own predecessors, for example.
The NCAA,
NAMA, FAN, everything. Because we only make money when you fly, and you don't fly, so we don't make money. No IGR being made. As a matter of fact, we are spending more money to maintain our airports and maintain our operations. You know, so we're draining out. We got completely drained out to zero and going into negatives. So we thought that when government give out that palliatives, we would benefit. And this is for the. It's not. The airlines are the key players, so naturally they will take a chunk of it. But there are lots of other operators or lots of other businesses around: ground handling, catering, travel agency, car hire, taxi, etc., hotels, food and drinks, and so on, and shop owners and what have you. So the airport is a complete system, or complete system of a market, if you like, where everybody plays a role, and then together they drive the economy around the airport. So all those people would be taken into consideration, and no matter how small, they will go a long way to help them to do their business. They've been shut out since March. So April, May, June, July, August, September, I mean, they've been just shut out. And I think some of them might not even be able to come back, going forward. But I have my other considerations.
Such as?
Well, regarding those who would do business and how we will help them. Such as, for example, people that are into travel agency. These people they're being shut out completely, 100%. And I think that their own, if you loan them money, it will be very difficult for them to even do business. So you should perhaps give them some grant if you can. And very many aspects of the aviation activity around there. But having said that, aviation has some resilience. We've seen the Spanish flu, we've seen the World War I, World War II, we've seen Pearl Harbor, we've seen 9/11, we've seen the SARS, we've seen all of these pandemics and catastrophes that has affected civil aviation. And every single time, aviation takes a dip and then rebounds back up and then continues soaring. And from the Wright brothers till date, aviation had always doubled every 15 years in its growth. So we're hoping that regardless of COVID, once the right things are done, the policies are put in place, government had done its own part and bit, and entrepreneurs have also done their own part and bits and pieces together, aviation will come and bounce back again and rise again and double every 15 years. This is as far as the aggregate aviation activity around the world. But in Africa, especially in Nigeria, we've shown that aviation can even quadruple every 15 years. Because since the coming of the Buhari administration, for example, we've quadrupled the number of passengers. We found the passengers at about 8 million per annum. Today we're doing 18 million, 19 million thereabouts. So in the next couple of months or so, we'll begin to hit the 20 million mark. And
but the airlines are complaining about patronage. I don't know if they've complained to you.
Well, I am speaking now more of general term, what we've been able to do in terms of growth. We met the passengers at 80 million, now we're doing 18 million. That shows that the roadmap we're implementing, approved by Mr. President, is working well. Patronage due to COVID-19 is a different matter. And we're treating COVID-19 as something that will come and pass by the grace of God. Even with that, we're not doing too badly.
Aviation Minister Senator Hadi Sirika. Outside our shores, United States President Donald Trump is said to have been COVID-19 symptom-free for the past 24 hours and fever-free for more than 4 days. This report comes from White House physician Dr. Sean Conley, who adds that, quote, his physical exam and vital signs, including oxygen saturation and respiratory rate, all remain stable and in normal range, unquote. The president has also had, quote, detectable levels of COVID antibodies and has not needed any supplemental oxygen since he was taken to hospital. Our Washington correspondent, Maria Bird, has more on the situation in the United States.
The U.S. is well over 210,000 deaths as a result of the coronavirus. And now the president and many White House officials are battling the virus as President Trump tested positive last week.
Don't let it dominate. Don't let it take over your lives. I stood out front. I led. Nobody that's a leader would not do what I did. And I know there's a risk, there's a danger, but that's okay. And now I'm better, and maybe I'm immune. I don't know.
The U.S. president spent several days in Walter Reed Medical Center being treated by some of the country's best doctors. Doctors said he's not out of the woods, but allowed him to go home on Monday night.
Over the past 24 hours, the president has continued to improve. He's met or exceeded all standard hospital discharge criteria. He'll receive another dose of remdesivir here today, and then we plan to get him home. It's been more than 72 hours since his last fever. Oxygen levels, including ambulatory saturations and his work of breathing, are all normal. Though he may not entirely be out of the woods yet, the team and I agree that all our evaluations, and most importantly, his clinical status, support the president's safe return home, where he'll be surrounded by world-class medical care.
The president's battle with COVID-19 happens while 9 U.S. states, mostly in the Midwest, experience a major increase in the number of coronavirus cases. This is being attributed to colder weather, forcing more activities indoors. While the impact of COVID-19 is increasing, President Trump confuses Americans, as in an early tweet on Tuesday, he calls off the coronavirus relief bill talks, stating that when he wins, there will be a bigger stimulus bill plan for hardworking Americans and small businesses. But in the middle of the night, he changes his tone and calls on House and Senate to immediately approve a bill that he will sign. From Washington, Maria Bird, Channels Television News.
Let's talk now to Maria Bird, who is in Washington, D.C. Nice to see you, Maria.
Good to see you as well.
Let's begin with the president, shall we? What's the very latest on him?
Well, his condition appears to be stabilizing, but we must remember, he's had the antibody drug Regeneron. There were steroids that were given to him that it still has not been clear as to what the steroids were for. We know that typically steroids aren't given until much later in the impact of COVID-19. Most of the time, individuals are almost on their deathbed when they're given a steroid. He had oxygen very early on. So, he was given some things very early in the treatment process that would potentially allow him to be doing as well as he is. But again, we've not received any information that says he's totally out of the clear or that he should not be quarantining and staying away from individuals, nor have we seen a negative COVID test since his entry back at the White House.
Now, he does seem to be conveying the message to the country that this is something that is beatable and that they shouldn't let it dominate the discussions or dominate their lives. How is that catching on?
Well, unfortunately, I think that this is disheartening. I think that many of his supporters, or especially those in the Republican Party who have seen directly the impacts of COVID-19, whether or not it's with their personal families or with those in their own communities that they represent. I think they were hoping that he would have come out with a little softer message after having the impact of COVID-19. But as we said, maybe he has not had the same experience as those who have died as a result of this very terrible virus.
Unfortunately, the other thing, of course, that is happening is that he's put a brake on all discussions about a second stimulus bill, saying that those kind of talks should resume after he has won. That was the statement he made, after he has won on November the 3rd. How is that being received?
Well, that initially, I think, was a shocker to the entire world. But specifically, those in his party were very surprised by that because they've been working very hard with the Democrats in Senate to try to ensure that there was a bill that was brought forth because so many Americans are suffering. They've not seen much of a relief since July when that stimulus funding ended. And so we're now in a position where there are so many Americans that are in need of something. We're entering into the colder seasons that just brings on a whole nother area of needs for the American people. And we know that what we did see when he asked for the to stop, we did see a decline in the stock market. We saw some economic impacts. But the moment that he changed his tune, they're expecting that the market will do very well today, which we've seen some uptick in the market today. So, unfortunately, this is all economics, and that this is, we're seeing that this is going to play down to the very end of this election season. And I think many people will not be surprised as to what might happen next or what might be said next from the president.
The CDC, that's the Centers for Disease Control, is reissued the warning that the COVID-19 virus can be airborne, can stay airborne for several hours, and can travel further, much further than 6 feet.
That is what's been said by the CDC. We heard that a couple weeks back, but again, that was retracted, and now it's being brought forth. Scientists and researchers, I think, put a lot of pressure on the CDC because that's what the research was stating and showing. But again, I think this is going to just further increase some of the anxiety that exists around the disease, around the virus. But furthermore, it will put some lawmakers and governors and city and local officials in a position where they potentially might have to reinstitute some of those guidelines that were in place in March, April, and May. And so we might see some of that phasing to actually roll back. We know the city of New York is looking to roll back and to implement some more guidelines because we're entering into months where people are going more inside. And obviously we know that being inside puts people at more risk than being on the outside and being able to be in the fresh air. So we're entering some times that could be very, very detrimental for America, especially since we have not been able to get a real handle on trying to see a drastic decline, not the slight declines, but a major decline, and to know how to really handle and put an end to the virus.
Before I let you go, I must ask that even though the president has dominated the news circle with his contracting COVID along with his wife, then the Joint Chiefs of Staff and so on, the economic battle is still ongoing with the states and even the federal government and the issue of unemployment. How is that playing out? What's the update in that?
Well, we're seeing that many individuals, there's obviously new markets that are bustling, and many people are finding ways to enter into new markets that are being created as a result of COVID. But that's not addressing, I think, the thousands and millions of people that are unemployed, that have not been able to get retrained, that have not been able to get rehired. Many of the restaurants potentially who have been able to rehire some of their employees might have to close down because we're entering colder months and not being able to have full capacity inside of the physical restaurant because the outside seating will be coming to a close here soon. So you're going to start to see that unemployment rate increase once again once we get toward the months of November, December, and January. So the question is how we'll be able to put some sort of stimulus within the economy to ensure that people are still able to buy, purchase, and most importantly, sustain just a roof over their head and food on their table.
Thank you very much, Maria Bird, there in Washington, D.C. Continue to stay safe.
Thank you.
Iran today reported 239 COVID-19 related deaths, bringing the death toll to 27,658 since the COVID-19 pandemic began. It is the highest official death toll in the Middle East. This comes as Scotland today recorded more than 1,000 new COVID-19 cases, the first time it has done so. First Minister Nicola Sturgeon has announced new restrictions to help bring down the numbers. Here's the global update.
The situation in Scotland has led First Minister Nicola Sturgeon to announce at a press briefing that pubs, bars, restaurants and cafes across central Scotland, including Glasgow and Edinburgh, will be forced to close for 2 weeks from Friday. including other restrictions for hotels, cafes, game halls, gyms and contact sports. She also warned people to avoid public transport in central Scotland. Scotland has been recording 730 new coronavirus cases daily on the average, compared with 285 a fortnight ago. Over in France, doctors are worried over the rise in the number of critical beds dedicated to COVID-19 patients. The number of cases in the country has risen to 634,763, with 10,489 new cases over the past 24 hours as of Tuesday. The capital, Paris, and its surrounding suburbs have been put on maximum alert, with new restrictions aimed at stopping the spread of the virus to be implemented for 15 days starting yesterday. The Belgian capital, Brussels, is warming up for new restrictions. From tomorrow morning, all cafes and bars and its surrounding region are being instructed to shut down for a month. Drinking alcohol outdoors will also be banned. The government says Brussels is now in the top 3 most infected cities in Europe, still below Madrid, but above Paris, where a similar rule for bars has already been introduced. Coronavirus restrictions have been lifted in New Zealand's biggest city, Auckland, which now joins the rest of the country at the lowest alert level. New Zealand has recorded no new infections among the general population in the last 24-hour period. In August, a local outbreak of the disease in Auckland prompted the closure of public spaces such as museums and playgrounds and a return to working from home. The relaxation has taken effect 10 days before a general election. Finally, the total number of COVID-19 cases in the United States is approaching 7.5 million. The country's cumulative number of cases reached 7,495,165, including 210,744 deaths at the last count on Tuesday. In the past week, only 4 states in the U.S. saw a decrease in number of confirmed cases, but at least 22 states reported more cases than in the previous week.
That's our COVID-19 update for tonight. You can take a closer look at some of the COVID-19 global numbers in real time by visiting our website, channelstv.com. There you'll get more updates and a better understanding of all you need to do to stay safe in this period. And of course, there are other stories in politics, business, and sports. Do join us for fresh packages after the program tomorrow at 6 and again at 9. Thank you very much for watching. I'm Ladi Akere Doluale. Good evening.